What's all, Ma?
What is autonomic dysreflexia?
Oh, so autonomic dysreflexia? It's pretty easy. So autonomic dysreflexia is a condition that the nervous system, the autonomic nervous system, creates as a response to overstimulation below the level of a particular injury. Normally, when you have an injury to the vertebral column of T6 or above, that means T6, 5, 4, 3, 2, 1, or cervical 7, 6, 5, 4, 3, 2, 1. Any injury T6 or above, the patient's at risk for this condition of autonomic dysreflexia, where if there's excessive stimulation below the level of the injury, like let's say you're sitting on your bottom for too long, because when I sit on my bottom for too long, my butt cheek goes numb, so I have to reposition myself. Or like if my bladder's full and I have to pee, I just go and pee. Or if I feel like I have to poop, I just go and poop. People that have this injury of a T6 vertebral fracture or above, they can't really feel the sensation below the level of the injury. They're usually paraplegics, which means they can't feel any sensation below the level of the injury, below their waist, excuse me, and they can't walk. So these patients, if their socks are too tight, if their pants are too tight, like they're wearing Lil Wayne's pants, if their shoes are too tight, if they're sitting on their bottom for too long, or if they have a distended bladder, or if they have fecal impaction, or they're constipated, all of those things send signals that say, hey, I'm uncomfortable. But because of the fracture, because of the injury, the brain can't register it. So your autonomic nervous system does something really weird, and it's called autonomic dysreflexia. It vasoconstricts, it closes off all the blood vessels below the level of the injury, which will make your feet feel really cold because there's not a lot of blood circulation there. And it'll vasodilate above the level of the injury, which makes the patient's face get really flushed, and they'll also get goosebumps. They'll also manifest a severe pounding headache because they'll have hypertension. The systolic blood pressure goes above 300, and that's the main issue with autonomic dysreflexia. So, as a nurse, you have to know that you have to sit the patient up in a high phallus position, and you also have to give them emergency antihypertensive drugs like hydralazine.